Dr. Kent, let's talk about Partners in Dental Health. First, tell me a little bit about the practice.
Well, we're a general dentistry practice. We treat the whole family here. We see kids all the way to the elderly. So we see pretty much everybody, and we can treat them for whatever needs they have, either cosmetic needs or pain needs.
Walk me through what would be a normal, routine, maybe whether it's a cleaning, and how in-depth do you guys get?
Well, whenever we bring a new patient in, we always do a full exam. So we look at not only their teeth, but we look at their gums, we look at their head and neck, the tissue inside their mouth to make sure everything is okay. And we do a full assessment of their whole health too, in a sense, to make sure there's nothing that's causing something in their mouth to cause something in their body.
And when you think of dentists, you think of course, oral care and oral hygiene. Let's talk a little bit about oral cancer. How prevalent is it?
Oral cancer is very prevalent nowadays. It's believed that there's going to be about 40,000 cases of it this year, oral pharyngeal cancer. And there's telling signs of it that we can help patients. If we see it early, we can help prevent it. So in our full exams, what we do is we do a whole head and neck exam, and we check to see if there's any signs of oral cancer.
And what would be some signs that you possibly would have oral cancer that people can look for?
Well, if the best thing to do is to see the dentist to be able to determine whether or not there's an oral cancer, and to see the dentist every 6 months. Now at home, the patient can actually look in their mouth. They can feel with their finger, feel for any lumps or bumps. They can look with a flashlight and see if there's any unusual red spots or white spots that are developing that are not normal. And that will help give them an alert that they need to come and see their dentist.
What are some of the risk factors with oral cancer?
So some of the risk factors primarily are excessive alcohol use, tobacco, smoking or chewing tobacco. Age is a determinant factor. Over 45, men are more prominent to have oral cancer, and people with HPV will be more likely to get oral cancer. And so we found that vaccine that they've developed now is helping diminish that, and as it becomes more prominent for people to get the vaccine for HPV, it'll help deter oral cancer.
So Halloween is coming up, and that is a time where a lot of kids and adults eat candy, but you guys have this really neat program, the Halloween buyback program. Tell me a little bit about that, how it works.
Yeah, so just go have fun, get lots of candy, get as much as you can, and then come to our office. We have 2 events set up for at our different locations where we will take the candy, we'll weigh it, and we'll give you $1 per pound. And what we do with that candy is we actually are going to give it to Operation Gratitude, which helps package the candy into other care packages, which will include toothbrushes and floss, and it will go over to military that are on deployment, and it really puts a smile on their face.
So it's a great cause given back as well. And lastly, how often should someone come get their teeth cleaned? How often do they need to be visiting the dentist in general?
Yeah, going to the dentist is something that's easy to do. It's something that it should be done by everybody every 6 months to check to see if there's anything that's going wrong. And sometimes stuff can pop up and it's not painful, and if we can get that taken care of before it becomes painful, then we can prevent a big problem.
Some great information. Dr. Kent, thank you so much. And once again, here's the information on the Halloween candy buyback from the Partners in Dental Health in Virginia Beach. It is going to be Friday, November 1st, 2 to 4 p.m. at the office at 317 Edwin Drive. 499-2100 is the phone number. And in Norfolk, visit their office at 7923 Halpin Drive from 3 to 5 in the afternoon on November 1st. And that phone number is 587-0874. For more information and to get that checkup scheduled, contact the Partners in Dental Health at 499-2100 or log on to the website partnersindentalhealth.com.